Hello class, I hope all of you are enjoying your research. Today I will be discussing the role renal function plays in terms of pharmacokinetics in younger and older populations. It is important to keep the normal physiological as well as developmental processes in mind when considering the safe and therapeutic use of medication. Neonatal and infant populations are quite vulnerable in view of safe and therapeutic medication maintenance. Several developmental and physiological immature differences contribute to increased sensitivity and toxicity, including drug absorption, protein binding, underdeveloped blood-brain barrier, hepatic drug metabolism, and renal excretion. Neonatal drug renal excretion is exceptionally low upon birth, and renal perfusion, glomerular filtration, and active tubular secretion persist at a lower function throughout infancy. This results in prolonged excretion and an unusual increase in intensity, particularly for medications specifically excreted by the kidneys. A study conducted using levetiracetam administration amongst a neonatal and infant population demonstrates the importance of careful medication management based on creatinine clearance due to the immaturity of the renal system. Levetiracetam is primarily excreted by the kidneys and utilizes tubular reabsorption, with neonates having both underdeveloped glomerular filtration and a reduced tubular reabsorption process. An increase in serum drug levels were noted to correlate linearly with creatinine clearance. The clearance of levetiracetam was found to have an exponential relationship with renal function as well as creatinine clearance. The average creatinine clearance for the newborn is 40 to 65 milliliters per minute, whereas the average adult younger than 40 is 107 to 139 milliliters per minute for men and 87 to 107 milliliters per minute for females. With inappropriate dosing and diminished renal clearance, prolonged excretion and increased intensity may eventually lead to toxicity and even death. Drugs that affect the CNS should be given at significantly lower doses with increased length of administration intervals due to the susceptibility of CNS toxicity in relation to the underdeveloped blood-brain barrier. Drugs that are primarily excreted through renal filtration should be avoided or given at lower dosages with longer administration intervals. By the age of 1 year old, the kidneys are functioning comparably to those of an adult. Common educational needs for parents and caregivers may include both verbal and written instruction. Educational elements may incorporate common signs and symptoms of adverse effects or toxicity, dosage requirements, common routes for administration, length of time necessary to achieve desirable effects, how to interpret a desirable response, storage of medication, and the need for follow-up laboratory monitoring as well as physical examination to determine the therapeutic response. Parents should also be taught to read medication labels specific to pediatric patients, as well as the need for medical consultation prior to administering medication to determine safety and efficacy. The older adult population are also at risk for altered elimination and excretion of drugs due to a decline in renal function. Older adults are at a much higher risk for drug-related complications when compared to their younger adult counterparts due to an alteration in pharmacokinetics, severity and quantity of comorbidities, the use of several drugs, and poor adherence to medication regimen. Kidney function begins to decline in early adulthood and continues to undergo degenerative changes. Excretion of drugs may be affected by renal perfusion, decrease in the number of functional nephrons, decreased glomerular function, and decreased active tubular secretion. In the presence of pathology and disease, such as chronic kidney disease, renal function may further be altered and elimination of drugs may be prolonged even more so. It is important to gather data related to creatinine clearance rather than serum creatinine levels because creatinine clearance determines renal function. Serum creatinine levels may be within normal limits, while there is a decline in kidney function as a result of decreased availability of lean muscle mass. With the decline of renal function being unique to the individual elderly patient, it is important to individualize medicinal regimen based off creatinine clearance and glomerular filtration rate. A study regarding the use of clonidine administration amongst the elderly population focused on plasma levels of the drug and hemodynamic effects derived from dosing. Hov et al. Concluded that plasma concentrations of clonidine were at the higher end of the therapeutic range. The geriatric population had a higher interpatient variability of plasma concentration level compared to the previous studies done in healthier, younger populations, which illustrates the difficulties of geriatric pharmacological treatment and supports the need for clinical efficacy measurements for these patients. If you see here, I have kidneys plus decline in function means caution. Older adults are 7 times more vulnerable to experiencing adverse drug reactions stemming from dose-related issues, often presenting themselves as nonspecific symptoms such as dizziness, confusion, and syncope. The adverse drug reactions are related to the serum drug accumulation due to decreased kidney function, polypharmacy, multiple comorbidities, severity of illness, use of drugs with a low therapeutic index, increased individual variation secondary to an alteration in pharmacokinetics, poor patient adherence, and an inadequate supervision with long-term therapy. Reduced renal function may be the most important cause for adverse drug reactions, and due to the interpatient variability of renal function, creatinine clearance should be determined prior to the administration of drugs majorly excreted by the kidneys. Educational points may... Oh, let me change here. There you are. Educational points may include the need for laboratory testing and follow-up evaluation with the use of medications. To promote adherence to medication regimen, an appropriate form must be chosen. Large print on prescription bottles may be requested. Use of pill organizer may be utilized. And the inclusion of family or friends in education for support may be beneficial. Furthermore, simplifying the regimen to include as minimal dosing intervals as possible would also prove to be beneficial. Providing education in an understandable format as well as providing written instructional material that fits the need of the individual patient is necessary to prevent any confusion regarding the treatment plan. And here I have my references. Alright guys, I hope you enjoyed.